Thank you so much. It is an honor to be here in London. Actually, my first time to be in London, so it is a history I'm actually making on my own. So thank you so much. So my name is Dr. John Kim. Just as we repeated, I'm a functional medicine pharmacist, so I was like, how does that even work? So I'm combining clinical pharmacy background plus functional medicine, and I actually look at root cause of the disease itself very, very differently. I actually work with a lot of patients dealing with chronic illness, such as Lyme disease, and especially mold toxins, the topic that we're going to be talking about and going to a deep dive in terms of how to treat it naturally. Well, we could spend all the money that we could do in terms of, binder red light therapy and all different things, including biopeptides. But if you are looking at the overall root cause of the issue in dealing with the disease, especially chronic illness, mold has to be one of the topics that has to be discussed all the time. Because I'm a strong believer that if you don't get rid of the overall root cause issue, and especially cleaning up your environment in terms of where you live, and you're dealing with mold toxicity, your body's not going to heal itself. And the body's smart enough that as long as you give the right tool, it's going to do its own. And I'm a perfect example of talking about that. And so I'm going to be discussing about my own personal history and my own case. So if you're not aware of me, I actually actively lecture in the United States in dealing with mitochondrial dysfunction, cell danger response, including many things dealing with drug toxicity. Pharmaceutical drugs are toxic. I'm a pharmacist here talking to you that drugs are toxic. And this is some of the things that I end up having to lecture about all the time. So this is me. I actually had a heart attack when I was 33 years old. And I didn't realize I was having a heart attack. Matter of fact, I went to my friend's wedding. 4 days later, I was having this heartburn. And I'm like, you know what? Why isn't this going away? And all of a sudden, that pain shot right down to my left arm. And I'm like, oh my God, there's something going on. And even though I know what was going on, kinda, because I'm such a stubborn idiot, I ended up having to go to an urgent care center instead of going to the ER. And then finding out that I was actually having a heart attack at that point. End up in an ER, and then my troponin level, if you think about troponin level, that's the level that end up having to be checked, is the how much of a damage that goes into your heart. I had literally nothing. And so even the cardiologist didn't even believe me because I didn't even have any classical symptoms of dealing with a heart attack, never alone, I'm pretty young to begin with. And so when they found out I was dealing with the symptoms, they're like, you know what, you're dealing with pericarditis, which is basically inflammation within your lining of your cardiac muscle. And when they did the echo, they found out that my left ventricle, so the lower portion of the heart, was not pumping correctly. Then at that point in time, they're like, you know what, you need to get to a cath lab. We need to put your stent in. And when they found out that I had an 85% blockage in my lower anterior descending artery, aka the widowmaker. And I had a lot of questions afterwards. Like, how did this even occur? At an age of 33, I thought I knew what I was doing, and I was still dealing with this. And then what if I end up having to deal with this again? And so I wanted more answers. Never alone, I thought about, is it stress related? Maybe I need to walk away from my job. So I went to my integrative doctor, and she was like, you know what? I think you are dealing with a stealth infection. And my visit to the ER didn't end there. I ended up back in the ER because they over-medicated me, and I told you about how drugs can be very toxic to you, right? Doing more damage than anything else. So I ended up having to deal with a syncope. I fell down in the middle of the night. And then in August of 2015, that's when I found out I had a positivity to Bartonella infection, which is a tick-borne illness, followed by mycoplasma pneumoniae. There's another tick-borne illness. And then I had high levels of mold antibodies with mycotoxins and elevated Epstein-Barr. So the diagnosis was that I had undiagnosed hidden stealth infection plus dealing with a mold toxin that's contributing to the actual heart itself. And so you might be wondering, is mold an issue for everybody? Is it just for you, Dr. John? No. If you look at the actual statistic alone, if in UK and USA, right, 2021, 900,000 homes in England had dampness going on in their house. If it's damp, you have a perfect environment for mold to grow. In 2019, 653,000 households end up having to deal with some kind of mold toxin. 7 million people died because of indoor and outdoor pollution, and this is coming from the health organization. I mean, I think they kind of lost their trust in terms of dealing with all the shit they did for the last 3 years. And then at least 45 million people in the United States dealing with an unhealthy level of mold, and then 40% of them end up dealing with asthma. And if you have any type of water damage at home, the growth of mold can actually occur within 24 to 48 hours. So today's objective is talk about how mold can cause cellular toxicity. Symptoms of mold toxicity is what we're going to be dealing with. Hidden danger of mold in terms of the cellular and mitochondrial health. And then how do we treat these patients in dealing with a functional medicine approach in an individualized way? So we're dealing with toxins all the time, right? I mentioned to all of my presentation that toxins cause deficiencies, especially nutritional deficiencies, and that can lead into cellular burden. And if you're looking at eating standard American diet, or is it a standard British diet? Is it something about that nature, right? Fast food, American, McDonald's, Taco Bell, you name it, very bad food. Exposure to heavy metals, petrochemicals, food allergies, oats, oat milk. Oats are containing heavy dose of mold toxin in there. That's another reason why I don't like oat milk. I don't tell people to do that anymore. Medication-wise, I told you about how pharmaceutical drugs can be very toxic. Certainly, vaccination come into play in terms of being toxic to your cellular health as well. Hormonal and metabolic toxins, followed by mental, emotional, spiritual toxins. I like to also add in people being toxic as well to your cellular health. And then stealth infections like bacteria, fungus, viruses, and today's topic will be the mold. So if you look at the symptoms of environmental toxins alone, fatigue, headache, gas bloating, heartburn, insomnia, trouble losing weight, premenstrual symptoms, all those are related to environmental toxins. But what if I told you that these are symptoms related to mold as well? It is so toxic that even in an ancient text in the Old Testament of the Bible, in the book of Leviticus, it mentions that a house desiccated by mildew, mold, and fungus would be a defiled place to live, to a point that God tells the Israelites to burn the house down. That's how bad it is. So the difference between the mold and mycotoxins, let's define that. Well, mold is a type of fungus growing in the multicellular filament, found in an indoor and outdoor environment in a perfect scenario where it's wet, dark, and it's warm, and produces tiny spores, because what they have to do, they have to reproduce and spread everywhere else, right? And then if you bother that particular mold, the mold is going to be releasing that toxic compound called mycotoxins, and as they act as a defense mechanism. So it's thinking about like a skunk. If you starve the skunk's going to spray everywhere, right? Just like that, that's what mold is doing to defend themselves. And that could contaminate your food, crops, indoor environment, and then the exposure can be inhaled. You could inhale it, and there's certainly mold toxins can grow in your lungs. I've seen that happening. And as well as can be ingested, affecting your gut microbiome, which we'll be talking about, and as well as skin contact, and can lead into harmful effect on the human health. And if you're talking about the symptoms of mold toxins and then symptoms dealing with the environmental, there's a lot of correlation going on that I mentioned before in dealing with allergies, asthma, chemical sensitivity, right? Irritable bowel, diarrhea, craving sugar, and people have trouble having losing weight, postural orthostatic tachycardia called POTS syndrome, people dealing with post-COVID sequelae issues, dealing with POTS right now. Is it the COVID issue, or is it the uptick of the mold in the body that the immune system is so low that it cannot undergo control on that issue, right? Raynaud's, you have trouble with the blood perfusion in the body. Sensitive to sunlight, headache, vertigo, right? Low immune system, vaginal yeast infections, chronic UTI. Any females dealing with chronic UTI, taking antibiotics all the time, you need to check for mycotoxin issues. That's number one thing. So is it a big deal? Heck yeah, it is a big deal, right? Because why? Because mold tends to be very stealthy, it's hard to grow, never alone, it's hard to detect. And then the liver, instead of actually processing and getting it out, secreted by the liver, it goes into bile, and then it gets recirculated, and then the body has trouble clearing things out, and so you have a bigger problem in dealing with a vicious cycle of inflammation in the body. And so how does the body get damaged? So it causes a lot of these oxidative stress going on, right? Number one is that mycotoxins can induce oxidative stress within the cells. Number two is oxidative stress, and there's an imbalance between free radical damages and antioxidant, leading into cellular damage and mitochondrial dysfunction, followed by oxidative stress leading into mitochondrial dysfunction I mentioned before, and cells undergoing stress response now. And then number 4 is that it leads into changes the function in the cells in the mitochondria, and certainly changing the function of the organs. And I've seen people developing autoimmune disease because of mold toxicity. So what is the most important thing that we have to do once you find this out? Avoidance is a key, but I actually go a little deeper than that. Number 1 is, when did the symptoms start, right? Were you living in a moldy house? I certainly was, right? Number 2 is, when does the symptoms get worse? Is it when you're visiting your parents' house, or is it somewhere else? And then if you are exposed, how do you feel afterwards? And if you could get out of the environment, I sometimes tell patients to get away from their house that are moldy for 3 days and then see how the symptoms are. Matter of fact, a lot of them feel much, much better because they're not exposed to mold constantly. Is anyone else in the household sick? I mentioned about how mold can grow in your lungs if you end up having to inhale that spore, and people who are immunocompromised, they end up having to produce these mycotoxins when they start talking, and that could end up having to make them sicker, and as well as they could make other people sick as well. I'll take questions afterwards. So mycotoxin, it causes something called a chronic inflammatory response syndrome. So mold releasing the mycotoxins, and the exposure itself doesn't happen overnight. It's a cumulative effect. And if you have a certain genotype called HLA, you have trouble getting rid of the mold out of your body. If you have trouble methylating it as well, there could be another problem. Followed by cytokine response, leading into several inflammatory cyclic effect at the same time. Now you're dealing with chronic immune system being suppressed. Mold toxins can suppress your immune system. You ever heard of a drug called statins for cholesterol? That's a mycotoxin. Okay? Mycophenolic acetate, that's for dealing with transplant medication, anti-transplant medication. Those are from mold toxins. So pharmaceutical drugs knows the effect of these mold toxins to suppress your immune system and affecting the cholesterol cascade and everything else, and they're utilizing these mycotoxins as pharmaceutical drugs to create much more bigger issues in our body. And so this is the reason why people have lack of tolerance to their environment. So I've seen people that end up having to have allergies and symptoms by just drinking water alone. And also autoimmune disease, food intolerance, and then having to deal with hormonal imbalance that's occurring. Happens a lot more in females. So mechanism at illness, there's tons of data available. I'm going to share 3 articles at this point, but in dealing with this, the mechanism of illness, it causes inflammation, oxidative stress, toxicity, infection, allergies, and irritant to exposure, followed by, right, some of the mycotoxins can actually change the morphology of your GI tract and affecting your microbiome. As a biohacker, I think microbiome is pretty important for your overall cellular health and detox. Well, it's affecting your entire gastrointestinal tract, causes leaky gut, more inflammatory process, more allergies building up. Now you're dealing with all these different issues. Number one thing that I didn't really take care of myself, I had a lot of gut issues, right? Gut issues leading into cardiovascular disease. That's already been documented. And now you're dealing with mold toxicity. Perfect environment for some kind of cardiovascular issues to occur. So don't be like me. Exposure to mold toxins can also cause reduce in malnutrition in kids, and it has been causing to stunting their growth as well. So it is a very important topic to discuss about, and creating a clean environment for your home, for your family and yourself to thrive. So even the bigger issue now is that it doesn't end there. Now it actually causes, if you end up with to combine biotoxicity, co-infections, and including tick-borne illness, Borrelia, Bartonella, Babesia, these are all tick-borne related illnesses. That's going to cause much more complicated inflammatory process, followed by environmental toxins such as heavy metal, pesticides. You could add an EMF as well. If your sensitivity to EMF, that's basically mold going crazy in your body. Okay? So altering the microbiome is at the same time DNA do epigenetic changes as well. So next we need to do is we need to plan and addressing the overall mold and mycotoxin issues. You need to find the right help, and a professional functional medicine provider is a key thing that you need to get in contact with. They're going to give you a lot of plans, the right testing, and as well as the 5 plans I'm going to be discussing about. So the first one is to remove the actual exposure. Find the right testing company to test the overall mold exposure you're dealing with at home, and depending on mold exposure, your remediation process is going to be changed as well. You cannot be doing this on your own. You need to hire a professional. And you need to also have a clean air purification system. I prefer brands like IntelliPure or Molecule. I'm not sure what's available here in UK and Europe, but those are top ones that I recommend in the United States. And regular cleaning in your house, so this way the mold burden is much, much less. Second, you need to optimize your detox pathway. I call it the drainage pathway. When you're dealing with this, the cells, organ tissues, lymphatic system, liver duct, and colon, let's just say your gut microbiome is actually affected. You're not able to poop that well, right? You're constantly being backed up with these toxins, and it's going to cause a backup of the actual drainage pathway. So you need to optimize that, allow your body to detox naturally. So first thing I need to do is I need to support the bowel. I love using aloe, marshmallow, including liver support would be milk thistle and scendra. And bowel support, I love using Body Bio Tutka. That helps with the bowel flow and it will help you digest fat, ox bile, pancreatin, and bitters. Third point that we're going to be making is to optimize your gut microbiome. Liver helps to convert toxins into water-soluble byproducts to be eliminated in the stool. But if you're dealing with constipation, what's going to be happening is recirculating that toxin and causing more toxic burden. However, when you have a healthy gut microbiome is able to reduce the mycotoxin effect in the body. So things I like to add in is a spore-based probiotic because it's able to decrease the toxic burden. Secondly, I love using sodium or calcium magnesium butyrate because butyrate is a fatty acid that's produced by the bifidobacter in a bacteria in your large intestine, but it also has a property to protect your DNA, helps to fix a leaky gut, at the same time is able to pull off the mold toxin off the DNA and your cell membrane. And that's the main reason why I love utilizing these two combo. And fourth reason would be to support your cell and a mitochondrial function, because when your mitochondria gets into a stressful mode because of mold toxicity, it not making energy anymore, is now going through a frenzy attack mode and a defense mode, and the cell's not able to respond that well. And so you need to unlock that, and the things to do, these are a combination I always use clinically right off the bat. Body Bio PC using phospholipids. Lipids are one of the things that is going to fix and unraveling the issue within the cell membrane, and that's something that I use after I deal with my heart attack to keep me alive, literally, right? Because I had so much vascular inflammation because of a mold toxin that Body Bio PC literally saved my life, okay? And balanced oil because now it's supporting both the bilayers of the overall cell membrane, followed by liquid mineral because you need the minerals to replace. And so Body Bio has a specific combination of these liquid mineral combination that they have. Sodium, magnesium butyrate, I mentioned before, protecting the DNA and fixing that. L-carnitine and CoQ10. You need L-carnitine to transport that CoQ10 through the mitochondrial complex. Where do you get L-carnitine from? Red meat, right? And supplementation. But this is the reason why a lot of times vegans dealing with mold toxicity, they have worsening of symptoms because they lack in some of these natural fatty acids as well as some of the amino acids that you need. Liposomal growth hormone, not surprising, followed by creatine. And next is to address fungal colonization by adding in some of the pharmaceutical drugs such as itraconazole or nystatin to kill off the mold. But I like dealing with more natural route by adding in oregano or skullcap or rosemary to really kill off the mold, followed by act as an antioxidant approach. And then you also need binders as well. I'm not a big fan of pharmaceutical binders like cholestyramine because that causes cellular damage and the mitochondrial dysfunction. So I like more dealing with the natural approach and using activated charcoal, bentonite, and fiber. So conclusion-wise, mold is an important consideration you have to make. You have to prevent mold growth in your house. And if you are dealing with mold toxicity, you need to work with a functional medicine provider like myself. So this is my contact information. I appreciate your time. And you can follow me on Instagram. I would love to keep in contact with you. I put a lot of information about mold toxicity and cellular health there. And if you need to do a one-on-one, I do provide that as well. You could visit my website to make an appointment. But if you have further questions, I'll be at the Body Bio booth. And you could come follow me there. And I'd love to continue this discussion with you. And I thank you so much for this time. Thank you.